Eating disorders we'll continue. So we were talking about bulimia nervosa. So here again binge eating होती है, intentional vomiting होती है, or other form of purgatives like laxative, diuretic, exercising. The BMI is normal in this case. Once a week this happens for at least 3 months, and you will see Russell sign wherein there are dorsal hand calluses because repeated purging with hands, with fingers. First treatment you have to refer for specialist care, of course, and appoint a bulimia nervosa focus guided self-help group. At least for 4 weeks you have to try this, and do a CBT, an eating disorder focus group. Okay, so children में bulimia nervosa focused family therapy trial of fluoxetine, anorexia nervosa clinical feature decrease in the BMI less than 14, decrease in the heart rate, decrease in the blood pressure, and large salivary glands is there. Abnormality in anorexia nervosa is decreased potassium, decreased FSH, LH, estrogen, testosterone, decreased T3 levels. There's increased cortisol and growth hormone. There's impaired glucose tolerance. There's hypercholesterolemia and carotenemia. Now we come to schizoaffective disorder. So इसमें schizophrenia जैसा होता है with mood disorder, and this is more than or equal to 2 weeks of psychotic symptoms without a manic or depressive episode. So this is schizoaffective. Schizophrenia में there will be more than 6 months at least. Delusional disorder, more than or equal to 1 delusion for more than 1 month. No mood disorder or psychotic symptoms in this case. So this is purely delusions. Schizotypal personality, there is cluster A personality disorder, falls on schizophrenic spectrum. Bipolar, there are 2 types, 1 and 2. 1 may there is more than or equal to 1 manic episode with or minus hypomania or depression. 2 may there is hypomania with a depressive episode. Mood normalizes between the episodes. So treatment, you will give mood stabilizers like lithium, sodium valproate, carbamazepine, and lamotrigine. Mood disorders with psychotic features, hallucinations and delusions. So in this case it's very difficult to differentiate from schizophrenia. So in this case you will give antidepressants with a typical antipsychotic and ECT. Adjustment disorder, this is less than 3 months after any stressor and it lasts for less than 6 months. Treatment, CBT, antidepressant and anxiolytics are given. Diagnostic criteria by symptom duration, this is important and this is the crux of any examination. तो कोई भी mania के episodes होंगे in bipolar, if they are more than 1 week or more than 2 weeks for major depressive disorder, acute stress should be less than 1 month. Pain post panic attack or post traumatic stress or disorder या delusional disorder, ये almost more than 1 month होने चाहिए diagnose करने के लिए. Less than 6 months adjustment disorder, more than 6 months phobia, generalized anxiety disorder and schizophrenia. So this is important. ठीक है, more than 6 months these symptoms should be there. Dysthymic or cyclothymic, if you want to judge, then the symptoms should be more than 2 years. Okay. Psychiatric emergencies, so first is serotonin syndrome, this will come in exam. Drug more than increase in the 5-HT, that is serotonin. So what are the drugs which will cause it? First are MAO inhibitors, and then selective serotonin reuptake inhibitors, selective non-reuptake inhibitors, tricyclic antidepressant, vilazodone, vortioxetine, buspirone, tramadol, ondansetron, triptans, linezolid, MDMA, dextromethorphan, meperidine, St. John's wort. So 3A is increase in the activity, neuromuscular disorder, neuromuscular attacks. There will be clonus, there will be increase in the reflux, increase in the tone, tremor, seizure. So this will be there. There will be autonomic instability, hypothermia, diaphoresis, diarrhea, altered mental status. Okay? And treatment, you will treat it with benzodiazepine or cyproheptadine 5-HT2 receptor antagonist. Prevention, you will avoid simultaneous serotonergic drugs. Okay? So you will avoid to combine these two drugs at any point of time. Hypertensive crisis, tyramine rich food with MAO inhibitor. Now what are tyramine rich foods? They are aged cheeses, then cured meats, wine, chocolate, basically the charcuterie which we see. Tyramine displaces other neurotransmitters in the synaptic cleft. So what it does, it increases the sympathetic stimulation, and that causes hypertensive crisis. So treatment will be phentolamine in this case. Third, we'll come to neuroleptic malignant syndrome. Now cause is having antipsychotics, typical or more than atypical, plus genetic predisposition is also there. So clinical features may myoglobin thus fever, encephalopathy, vitals are unstable, enzymes are unstable, and rigidity is there. Treatment, you give dantrolene, dopaminergic, bromocriptine or amantadine, benzodiazepine also can be given. First and foremost, you have to discontinue the causative agents in this case. Now we'll come to drugs in psychiatry. Basically, I just want to show you that